my name is Shauna and I'm with GetTherapy.com. Today we're here with Dr. Mary Ekdahl, child and adolescent psychologist at Arkansas Families First and a volunteer with the American Foundation for Suicide Prevention. This week is Suicide Prevention Week and we're here to talk and do our part in raising awareness. In Arkansas, suicide is the second leading cause of death in ages 10 to 34, and every year we lose about 500 people to suicide. So Dr. Ekdahl, tell us a little bit about some of the warning signs.
Sure. There's the more obvious warning sign of someone talking directly about suicide or means for suicide. And in that case, I think our community has become more aware of the importance of taking that seriously and responding immediately. There are other risk factors, though, that may not be so obvious, but certainly someone talking about an intense emotional pain that they don't feel like they can get away from, that they can't escape. People talking about and feeling hopelessness about their situation. Also, people who have experienced a recent change. Maybe they've never been particularly aggressive, but they become a lot more aggressive and angry, or they have a significant change in sleep patterns, where they're sleeping too little or sleeping too much. Some of those warning signs can be the need to reach out to a mental health professional.
Yeah. So what are some actions that someone could take if they're seeing these thoughts?
Okay. So if someone is at imminent risk and you feel like they are planning to harm themselves, then stay with them. Don't leave them by themselves until they can access some mental health care. If someone, kind of for the longer term risks, then you want to have a safety plan, and there's some specific components of the safety plan that include limiting access to means for suicide, having someone aware of their own triggers so that they know in what situations they're at risk, so they can reach out for help or support, and then having some of the things that people can do to help themselves feel better, so activities or people that they can talk to. It's important to have that community of support, especially.
Thank you for sharing that. So to close off, what are some resources available to people in these situations?
Okay, well, certainly a mental health professional is an excellent resource, and you want to reach out. 90% of people who die by suicide had a diagnosable mental health condition at the time of their death, and it was a typically not treated condition. So reaching out for that help is really important. And then we have great resources in our community. The American Foundation for Suicide has an Arkansas chapter at afsp.org. I think you can get a lot of great information from them, and there's lots of community events and supports. Those are available both for people who are at risk and people who've lost someone.
Yeah. Well, thank you to Dr. Ekdahl for sharing with us today. We hope this information is helpful to you. Thank you for watching, and check out the full article to learn more.